Hi, I'm Ilene Carol, host of Unseen to Unstoppable. On this episode, our guest is Dr. Cashmere Miller. Dr. Cashmere Miller is a dedicated family nurse practitioner and leader committed to improving health outcomes, particularly for underserved populations. As the founder and executive director of Community Whole Health, she is actively working to bridge healthcare gaps and provide vital resources to those in need. Her work is driven by a passion for whole person care and a deep commitment to serving her community. Cashmere, welcome to the podcast.
Thank you for having me. Happy to be here.
So, in your journey, I was just reading your bio. It says, you've been studying nutrition to becoming a doctor of nursing practice and a lieutenant commander in the U.S. Public Health Service. That's an incredible achievement, by the way. What inspired you to pursue this path, and how has your faith shaped your career?
Well, it has been a group of things. It has been a journey because, and I would always say my life and everything about the way it went is a testament of God's hand because I didn't necessarily fall into the public health service from always wanting to do it. My path really started from this increasing desire over time to serve vulnerable populations and underserved communities. And it really started when I was growing up. I grew up in a bad neighborhood, poor neighborhood, and often seeing people who go unnoticed, overlooked. And so when I went to college, I did pursue a degree in nutrition at first thinking, oh, wow, it helped me kind of transform my weight and everything when I was transitioning from high school to college. And then I started learning even more how food is medicine. And it really shaped my perspective on health and wellness overall. And it became an integral part of me understanding overall health. So then transitioning into nursing, I gained some valuable experience there, but then I wanted to go further to become a nurse practitioner to have that autonomy. And so I joined the public health service because I desired to, one, serve my country. And then also, really wanted to extend my reach. I always felt like, wow, helping one person is not enough. I want to help more people. And in my mind, I just felt the public health service gives you this opportunity to help populations. And that always attracted me. And so I figured, hey, I can really just attack these systemic barriers that are in healthcare that I'm seeing. And so, especially when it comes to health literacy, that's a big one for me. And so, I just think God really led me on that path. And one of the things that I'm always going back to is Proverbs 3, 5, and 6. Trust in the Lord with all your heart, lean not to your own understanding. And so, in all your ways, acknowledge Him, He'll direct your path. And that's what I've been seeing happening for me because there have been times where I felt like, well, what am I doing here? What
Right.
is this? But then I see how all those pieces have connected and how it's so useful, even for what I'm doing now with community whole health. And so that verse reminds me because I've overcome so many challenges, really, and have lots of triumphs as well. But it just helps me to remember why I'm doing it, and that's really what keeps me going, and that's shaping the trajectory of my career.
I remember someone telling me the same thing you said, you remembering your why. That's important because I too was getting a little frustrated and disappointed with something I was working on. And that's what somebody said to me, remember your why, because um, things will happen that will be like, why am I doing this? But then you
Mhm.
remember that you're on a mission to help people. I see that you're a clinician within the is that how you said vet home at the VA?
Yes, it stands for Veteran Exposure Team Health Outcomes Military Exposure. Yeah.
Perfect. Can you share a pivotal moment or experience that deepened your commitment to advocating for veterans' health?
Sure. So within the public health service, we're assigned to different agencies depending on what you do. And I'm a clinician or practitioner. And so my assignment is at the VA. It's where I've been assigned there for the last 4 years. And so one of the pivotal moments and experiences that really deepen my commitment is just talking to patients. I always have these one-on-ones that turn into lengthy conversations and just sharing. And these folks, military service members, these veterans, some of them have really been through the ringer. And so I remember talking to one of them, served in a combat zone, just sharing his struggles and highlighting how and just how he feels is connected to different toxic exposures, and just listening to, like, wow, he's identifying where it's coming from. And he also shared, people don't listen to me, I've been trying to tell them this and you're listening. And it just made me realize, okay, people, hearing them out is important. And then really just making them feel like they're heard and what they're saying is important, because they serve this country. So I have a deep respect for them. I have veterans in my family, but those are the times when I just feel committed to serving veterans. And then it also shows me not only veterans are the ones that are struggling with this. These are people, they may not have served the country, but they too feel unheard by their provider. They too feel like, I only have this short amount of time and I'm trying to share all these issues of how I got to this place and you're not listening. So those conversations are what fueled my passion for systemic change, with not just within veterans healthcare, but also outside of it, so that we can improve their health outcomes, and then for the community at large as well.
Why do you think that is that people aren't listening to them? Their healthcare is that we're saying that their healthcare providers are not listening to them?
Yes, and I think it's a complex answer, because on one hand, when we're talking about military service members, there are providers, clinical providers, who are caring for these folks who honestly do not have the cultural competency to do it. They don't understand military um, culture. They don't know. They don't even know how to refer to them. Even I didn't know that when I first started. Like, people from the Air Force, you call them airmen. I was calling everybody a soldier, so that offends some of them.
Let me stop you there because I want to know that because I always like to not offend anybody. So so let's talk about that just a minute, but then get back on the healthcare part. What is that about?
It's because when you join a particular service, they get immersed in that particular culture. Like, if you become a Marine, you are a Marine. If you call them a soldier, they're looking like, we're not a soldier. But in the Army, those are soldiers. And I haven't joined the armed forces, which is different from the public health service, but I do know and I have learned to address them properly, because for whatever reason, when they were out there being deployed, those people were their family. And so they have this deep connection to that culture, because when they were training, they trained through the customs and all that stuff. And so when you've gone through so many things with those people together, I guess when you come out and people are just addressing you any old kind of way, it does offend them. And so at least I get that part now. And you won't catch me calling, you know, an Air Force vet a soldier ever again. You won't like, even Navy folks, they're sailors. You have to really understand some basic things so that when you're talking to them, you're respecting them and what they've done and where they've come from. And at least because I have the deep respect for them, I try my best to do that. I was offending them left and right at first, 'cause I really didn't even know. Even people in my family, they're from the Army. This is why I'm so used to saying soldier, because they said soldier and I thought all of them were soldiers. And so technically, yes, but when it comes down to their specific cultural differences in terms of the different branches, it is a different culture.
So now going back to the healthcare, can you say it was a twofold or complex answer with people feeling like they're not being heard or listened to within the healthcare? And I
Okay.
interrupted because I have short term memory and I wanted to and I wanted to find out because I don't want to offend anybody because I'm like you. Everybody I knew was in the Army, and I don't know. I may come across somebody in the Air Force or Marine, and be wondering why they're giving me the eye.
Right. Well, so the second thing what I was going to say was that, so one, yes, they don't have that cultural competency. The second thing, and this goes for everyone, not just veterans, but they don't have enough time. We don't have enough time sometimes, and that's out of their control. Like when I was in primary care at the VA, it felt like, wow, I have 15 minutes with this guy, and then I have to tell him not get out literally, but it's like bye. And that's not right, because how are you supposed to really get a full understanding of what they're coming in for, why, and then addressing it in 15 minutes? And that is way beyond our control. That's beyond our supervisor's control. And when you're talking about the private sector, it's the same thing, and it's about making sure that they're getting those reimbursements based on how many patients you see, so that you can bring home a decent income after you went to school for 12 plus years. So I get it, but there's got to be a better way where we can provide care so that our patients can feel heard without rushing them because we have that financial aspect to deal with.
Now, I saw something on your resume. It was called military environmental exposures. Can you break that down? Because I don't even know what that would be. And then it says what are some things that might get overlooked?
Okay, so military. So one thing is, I did write a paper on that, but military environmental exposures is now a term that we use that's really referring to a range of health hazards that military service members could encounter during their service. So it often is specific to where they are operating. It could be in deployment, it can be what we call in garrison, like they're at a military base. And if they were exposed to something hazardous, and that's how we refer to military environmental exposures. And that could include anything from maybe a burn pit, um, where or chemicals that were used in warfare, or maybe even just hazardous substance. If you were, let's say you were a mechanic in the military, you would possibly come in contact with hazardous um, substances or chemicals from fixing airplanes or whatever, or even airplane smoke. All those things could be toxic, but it doesn't automatically produce a toxic effect. It depends on how long, what exactly it was. And so overall, that's what military environmental exposures are. It's what's in your environment while you're serving, whether you're deployed or you're on a military base.
Because I told you, before we started that my father, had ALS,
Hmm.
and for whatever reason, the military claimed the disease.
Right. And again, that is specific to a lot of things, specific to where he served and what he was exposed to, because certain areas of war, any conflicts, tended to have more exposures. Like, for instance, Southwest Asia,
Mm-hmm.
if vets went over there, they tended to be exposed to burn pits. If you served in the first Gulf War, there were a plethora of things, probably still some things that we're still trying to figure out they were exposed to. So there's a term, War illness, which is really a conglomerate of symptoms that vets kind of manifested after serving that we really don't have a name for. So we called it Gulf War illness because we don't know exactly what the exposures were. There were all kinds of nerve agents and different things that they could have been exposed to, and some that we discovered were in fact over there. And so we're still trying to figure it out. So it depends on where they served. It depends on what they were exposed to. But yeah, the exposures can possibly lead to a range of health issues. That can be respiratory diseases, cancers, neurological disorders, and a host of other systemic problems. But it depends on where and when they were, like where they were and when they served.
So, what are some of these Gulf War symptoms? Just
It could
some.
be, so headache could be one of them. Let me think. I know, because that's a big one. We're doing a study on the headaches right now. My mind just went blank. I can definitely provide some information after this about Gulf War syndrome, but it's a host of symptoms, and
Okay,
that's an old term that we use.
I see.
We
I
call it
see.
now chronic multi-symptom illness,
I
but
see.
yeah, because it can be so many different things that's going on with your body, different systems. It can be your stomach hurting, you're having nerve problems, muscle aches, different things.
Okay, wow. Okay. Now, you mentioned that you had written an article on the environmental exposures. Is that the one that was featured in the American Journal of Nursing?
Yes, yes.
Okay. And so, from that article, what's been the response from the medical community, policymakers? Do you feel any progress is being made in this area?
I do feel that the article was very impactful, and it has been heartening because, first of all, it was archived, the VA archived it into their National Resource Library for clinicians. And so that just let me know they're serious about raising awareness and they understand the importance of this writing because it wasn't just about what the exposures were, it was also about whole person care and how that helps with the symptoms. And so the article was written, it came out of the PACT Act. I don't know if you're familiar with that. It stands for Promise to Address Comprehensive Toxins Act. It was passed in 2022. And so it prompted me to write about this because the PACT Act was passed because it was to expand healthcare benefits and different services to veterans, but also within that law, it mandated provider education because of what I said earlier. We do not have enough providers that have military cultural competency. We need more education about exposures, about military life, so that we can now better care and treat veterans because we need better healthcare outcomes. And so that article was written to provide a number of things. It was really a high level overview to inform people about, hey, this is what a burn pit is, and this is where your patient may have been exposed to it. Agent Orange is this, and this is some of the symptoms of exposure, and here are some of the conditions that result, and different things like that. And so now we're seeing that more clinicians are engaging and they're looking for resources to improve their care protocols. And really, the article is like to start a conversation, the catalyst for a dialogue, and to remind providers that advocating for your patients and really having that evidence based research are two critical things when you're talking about veterans.
That is amazing. So, thank you for that. I mean, I went to the VA a few times and I ended up having to get people from my congregation to go because I was so over it. I'm not gonna say where I'm at because I'm not calling anybody out. But I will say this. There was a young woman, I was friends with her sister and that family. I grew up with that family that she married into. And so her sister moved here from Pennsylvania. And so she was very aware of the VA there and she was involved. I think she even did some work there and whatever. And she came here because her sister was here and had to help her dad. And so I'm so glad when people clarify things to me, or I don't want to say justify, but just that validation. I guess it's not me, but anyhow, she was like, "What in the world?" And because I went there and I walked out like a couple times because I just was so. I guess I'm an emotional person, not like what I want to say, like my mom was a nurse for 40 years and she was like none of her children wanted to be a nurse or go into the medical field, but for me, and I don't even know if I ever told her this, it was just because um I pick up on people, their energies, their pain, and different things like that. And so I have that sympathy type emotion or whatever. And so for me being there, it wasn't about me and how I felt while I was there. I just felt like, how disrespectful, right? I
Hmm.
mean, like, first of all, somebody's giving you a job. And second of all, these people made a choice to serve the country, um, and have come back messed up for the most part, not all, most. And this is how you are. And so I just had to walk out because I was like, I'm over it. But when my mom got sick and everything, and I was trying to, get her benefits and stuff straight through my dad and stuff, I had to go. I had to suck it up anyhow. Both of them went with me because it was just hard for me. It was just hard for me. So I'm just glad there are people like you that do care, even though your time is limited and things like that. Because, um, I'm not sure why the world is the way it is, but it's a mess.
Well, like I said, it's a systemic thing, and I sometimes I do understand. I always tell my colleagues like this: it's a double-edged sword some days because there are people who really care at the VA. You do have people at every job who go through the motions, but there are really people who care deeply, but they are being burnt out because the structure of how we see patients, the timing, and they want and this I was in primary care
Oh, you know
and
what?
doing
I'm sorry. Let me clarify, Cashman. I'm so sorry. It's the hospital part was amazing because my dad was there and they took wonderful care of them. Because my mom, being a nurse, she tried to do everything she could for him because when he got ALS, they during that time they basically like, you're gonna die, and they didn't give her any support or whatever. So with her being a nurse, she was able to take care of him until she just kind of got burnt out. But I'm talking about the administrative part of the building, not the medical. I'm sorry. I
oh,
need,
okay,
yes,
got
yes,
it.
ma'am. I'm sorry. Yes.
Okay.
Yeah. Yeah. No, no, I am so sorry. No, heads off to anybody in the medical field. I don't want anybody to be like, what? No, that's not what I'm just referring to, the administration part of it.
Okay, got it.
Yeah. Yeah. So let's switch gears and go to your nonprofit. It's called Community Whole Health. Tell me about that.
So, community whole health is really, I put it all in the name. We want to provide access to healthcare, provide access to health education, and support to people who are medically underserved. And that could mean when you're medically underserved, that could mean you're low income, you don't have insurance, or you are underinsured, meaning, you can't afford the high deductibles and co-payments that you have with your insurance. So we want to serve those people.
So, I mean, walk me through it. Like, what happens when somebody comes into your establishment?
So we part of what we're doing right now for the last year and a half is mainly the education piece. We're having a grand opening for our clinic in September. We're going to be partnering with Emory Healthcare in Lithonia, Georgia. They have a Emory Hillendale Hospital. We're going to be on their campus. But what we've been doing for the last 2 years is in the community giving health education because health literacy is an issue. It's actually a lot of Americans, especially those who are, lower education, lower income, tend to lack the understanding that they need to deal with the risk factors for chronic diseases. So, what we do is we host quarterly workshops on different aspects of lifestyle medicine, which is what our organization, what our clinic, what our healthcare is based on as a foundation. And lifestyle medicine has 6 pillars. It's actually a governed body, the College of Lifestyle Medicine. It's a real thing. It's based on evidence and it's interventions to help people improve their health. And so the 6 pillars include nutrition, which is really advocating for plant based diets and other mindful eating principles, physical activity. Sleep, importance of sleep and restorative rest, stress management, avoiding toxic substances, whether it's drugs or alcohol or anything else that could, cause an adverse side effects, and then social connection, because these things contribute to your physical health. And so what we do is we have workshops, we have different guests. Last month we had a physician who is a whole health champion. She's really big into whole health, and she did a stress management workshop called Power of the Mind: Tools for Everyday Resilience. And this was so important because the folks that came, it was addressing directly what they were dealing with, the depression. Some of the folks shared, one of them shared that she was, physically abused and she was overcoming anxiety dealing with that. And so we have people dealing with these things and we're not talking about it and we're not giving practical tools on how to address it, because if it goes unchecked over time, it starts to cause symptoms and it affects our physical health. So we focus just as much on the education as we will on the healthcare. So when we open our clinic, it's going to be volunteer based. We have retired folks on board to come, and we also have people who are actively working in their fields to come and provide care based on lifestyle medicine principles, which doesn't mean we'll ignore medication and things like that. We obviously know some people need it, but we're trying to make people accountable for their health. We want people to take a stake in their health and not just have the provider be the only one that cares for them. Like, hey, don't you care that you're on the road to diabetes? Hey, don't you care you could get kidney disease because you're not? We want to teach them why, the why
Right, right.
behind
The
it.
why, the why.
Yeah.
Um, a doctor that I interviewed yesterday, she's a psychologist, and I mentioned her a little bit before we started the interview, but that's what she does with helping women midlife doing the pivot that to address, like you're saying, the why, but for her to address the cause,
Hmm.
and that's important. I'm glad that, you all are doing that because, nobody thinks about that, addressing that. And so based on some of the things you're saying, let's talk about maybe the differences between your approach and, traditional medical models today.
Well, the I use this term a lot, like I said earlier. The traditional approach is sick care. That's treating symptoms, and it's getting old. We're finding that the things that we're eating is causing health problems. And now, we're starting to try to address it. But our model, because it's lifestyle medicine, we want a wellness model. And so we want to move away from that sick care and start to address root causes, and we're going to use things that they can do themselves as a starter. Now, like I said before, there's certain things that's beyond your control. We don't want you to have a stroke. So if it's at the point where you're clearly unable to manage it, obviously we will provide hypertension medication or any other, treatments that are necessary. But our emphasis is on lifestyle changes and making them realize everything is not hereditary. You
I'm sorry.
actually can change this.
I'm sorry because I say this to my friends all the time, and I hate to do this, but I mean I don't. And I mean I try not to be this way, but I can't help it sometimes. I don't know if it's a racial thing or whatever, but I just feel like every time I walk into a medical facility and everything, they automatically assume that I have diabetes or high blood pressure.
Mm,
And I'm like, no, I don't. And they keep asking me, and I'm like, no, I don't.
yeah.
Stop trying to make me have that and then put me on medication. And then you put me on medication, and then I do have it because you put me on medication.
Yes.
And I don't, so I don't know what the reason is, but it's like, everybody doesn't, that looks like me or whatever, they don't, have high blood pressure and diabetes.
I think
So
part of the reason again is lack of time. A lot of and that's what we're going to ensure we have is time. We're not there to rush you out. We want a comprehensive assessment. You're going to fill out this paperwork. I want to know your eating habits. I want to know what you're taking. I want to know how much sleep you get at night because that impacts a lot of things about your health. It impacts your blood pressure as well. These are the things that we're going to ask because they are important for your health. These things that they don't realize can actually prevent or help them manage or even reverse what they have. It's possible. And I don't think people believe that without being, on a
taking a pill.
medication. Right. Right. Yeah. And it's not, and they're so easy to line up for a pill because they don't want to do the work either sometimes.
Well, speaking of doing the work, I want to know, and my listeners probably want to know too, what are some practical ways that we all can start prioritizing on our health beyond, just treating symptoms? What are some things we
Uh,
can do?
well, it does. And let's go through the pillars then because it depends on what you're dealing with and it depends on how you're managing it. So let's say talk about food because food is powerful. Are you doing the basic? Because most Americans are not getting enough fiber. And a lot of people ask me, well, how do I get enough fiber? Are you eating fast
Eat
food
eat
more?
vegetables.
Right. Eat vegetables, but then what vegetables are you eating? And it's not just vegetables, to be honest with you. It's really high quality carbohydrates, believe it or not.
Well, I
Are you
can't
eating
have those, so I eat vegetables.
the kales, the quinoa?
Oh,
It's
oh,
like,
and look, and I sprinkle ground flax seeds.
yes, it's nutrition is a part of it. And then if we're talking about, physical activity, listen, just because someone is slim does not mean they don't need to exercise because exercise in itself does something on a cellular level. It helps lengthen something called a telomere. And those are like these protective caps at the end of your chromosomes. And they help, like, they contain DNA and all that. But when you exercise, these cellular markers, you are helping to extend your life. You are improving cellular aging. It can help you with wrinkles, but it's helping you live longer. That's really the most important thing.
You said
So, yes,
wrinkles.
physical exercise literally can lengthen your life. There's so many studies on it, though. Like, please, no one should be taking the word of a person anyway.
Hmm.
Look at the studies.
Right,
There's
right.
research to prove what we're telling them. So that's another thing. Go for a walk. And actually, the if you're doing low intensity, you may need to do it more often. But if you do high intensity, something maybe like running or jumping jacks or something like that, sometimes you might need to add some muscle, building things like push-ups, or even if you have to, what I call the girl push-ups. Just do whatever you can, because physical activity is just as important. And then, of course, something we're always dealing with is the stress. Everyone has some form of stress. It's all about how are you managing it, how are you channeling those issues and behaviors when you're going through something. So, you know dealing with that. Sleep, again, how many hours are you getting? I'm always asking people because they're like, "Oh, I have a headache." Well, do you sleep regularly, at least 7 hours a night? And it's like, actually, you can prevent headaches. The quality of your sleep matters. Are you drinking enough water? Like, some of the things are so basic, but
Right.
because we're not used to doing it, we're used to getting by. We don't realize that all we have to do is address these things, and we would feel probably 50% better within a week with doing some of the basic things.
And let me just say, in the defense of fast food, which I'm not a fast food eater, by the way, but I'm just saying because I say this with some of my family members. We talk about this too. Um, it's just so much cheaper, And
Yeah.
I remember watching a report. I don't remember how many years ago. I don't know if it was during the pandemic years or whatever, but it was this thing. It was like this, like it's obesity is an epidemic in America. We gotta do something about it. It's epidemic, And I'm thinking to myself, okay, if it's such an epidemic, can you please provide more affordable, healthy food solutions?
Right.
It's $1, $2 to go to McDonald's or whoever,
Exactly.
And I'm not trying to justify it. I'm just simply saying that that's the problem right there. It's affordable, it's convenient.
That's true. That is a part of what the social determinants of health. You looking at access, where it is. But another thing too, and I understand what's convenient and all that, and I'm really bad at this, but I think we do need to figure out how to grow our own. I haven't done it yet because of time. But I do chalk up the funds for at least produce, make sure it's organic and fresh and things like that, because that's really important. But if we could go back to growing our own stuff, because the preservatives, yes, the sodium, the sugar, it's making conditions like diabetes and hypertension much worse.
Yeah, yeah, I agree. I agree. So let's talk about your faith. I mean, that was in your bio, that you rely on your faith. You've even quoted a couple of scriptures here. Eh, are you integrating any of that spiritual knowledge, with emotional well-being into your approach to medicine?
Well, yes, for sure, because it's a part of who I am and I can't really shake that, but it's always in a respectful way. But it's also because spiritual health is still a core component of who a person is.
Hmm.
And and that may be different for other people, but how their faith is, how they view faith, and their world view still influences their health behaviors and how they become or not become resilient. And so I do include it. I am very careful and respectful. If someone shares with me or ascertains, that we may share the same faith, oh wow, you read the Bible, you're a Christian. I ask, I've asked numerous times, is it okay that I pray with you? And if they give me permission, yes, or if they share with me that they believe the same way I do, I'm encouraging them with scripture to let them know, hey, you can do this, you can overcome this. This is what the Bible says, but never do I proselytize. I don't want anyone to ever feel that I'm trying to force or convert them, to
Right, right,
my beliefs. That
right.
is not what I do. But it's always from a respective place. Like I'm asking, but many of my patients have shared and given me permission. And actually, I've never had any like resistance or problems with that, except for once, and it didn't come from the patient. It came from a colleague who had a problem with me praying with the patient. She overheard it. I had already received permission to do it and to talk
Mhm.
about it, but she didn't believe the same way, so she had the issue. And that was the only time I've ever had an issue throughout my whole entire career, because my goal is not to proselytize. My goal is to help them. And if I find that we have something in common that I could help you with, I'm going to use it, because I really do care. That's where it's coming from, a place of caring.
Right. And I think when people, see that that's where it's coming from, you know, that's why you haven't had any problems with it. You had a problem with the one person who, and I mean, not let's not call her out to the carpet, but maybe she was an atheist or whatever. You know what I'm saying?
Right.
That's you know what I mean. That's why
Right.
that's why the problem, because she didn't believe God exists. So, you know, what is a common misconception about healthcare for underserved communities, and what do you wish more people understood?
Hmm. There may be a couple of things, because I've heard some comments. I'll say one, someone has shared with me about, like, for instance, I told someone recently, what I was doing, and she's like, "What do you mean they don't have health insurance? There's the Affordable Care Act." And I'm thinking, okay, you definitely don't understand. That's what I was thinking in my mind. But people, I think they feel that underserved people are underserved because of their own individual lifestyle choices, and that's it. Like, oh, if you didn't do this, then that, and
Like
that's
it's their
not,
fault.
yeah, like this is your fault. And so, and I just know, obviously, from growing up that way, that is not the case for everybody. It's that not everyone's fault that they're stuck or in a particular situation that they need a helping hand out of. And so I think, just like you mentioned the example of being obese, in some low income areas, food desert areas, it's not just because they're eating too much. It's sometimes because their poor diet is all they have around them, or that they could even afford. They don't have it. And then it's like, what about what's in the food they're buying too? Let's talk about that. Even when you go to the grocery store, what about what's in the food? You don't have time to maybe make a fresh whatever. You're buying packaged items. Some of the stuff shouldn't be on the shelf, to be
Right,
honest.
right. I'm glad you mentioned that, because there was a segment on 60 Minutes, a doctor from, I think she was from Harvard or somewhere, but anyhow, I was so glad that she was on, because she headed that problem on. She was just like, look, everybody's not obese just because, they're eating their way to obesity or whatever. There are factors, or the brain. I think her study was mostly with the brain.
Right.
But also, like what you're saying, there's factors that play into it. So it's like the same thing anyway. We're in the same thought where you see somebody that's obese and you automatically assume XYZ.
Right. And it
Yeah.
could be a number of things that have contributed to why their metabolism is so slow, or why, they can't process certain things. And I do believe, again, in accountability. However, you can't just make those blanket judgments.
Right. Right. So leadership and impact is a big thing with me. I try to do my part. I was asked to mentor college students with a local college here in 2016, and so I try to do my part with that. And so I see that in 2024 you were honored with the She Leads Georgia recognition. What does leadership mean to you, and what advice would you give to other women who want to make an impact in their field?
Um, I've always kind of been a servant leader, so that's more of right now what it means to me, because it means serving others and setting a good example, and having a impact is what leadership is too. It's like, who are you impacting, and what are you impacting through what you're modeling. And so I just think that it's important to do that for positive change, but also, I know a lot of people are looking to make impacts in their fields, but I would just say you have to do it within your purpose. That's also my opinion, because if you're trying to, be a leader and do all these great things, and that's outside of what you were called to do, I just feel a lot of people have resistance. It's not going to always work out. You have to surround yourself with people who are going to encourage you to operate within your calling. And I think a lot of folks are kind of looking at other people and, oh, I want to do this like her. And those are great things. Like even winning that recognition. Well, it's not that I won it, but receiving that recognition, it came from Liz Doyle and Dr. Alveda King and Dr. Ginger Howard. That was truly humbling because they were recognizing a Christian woman in leadership trying to make a change in her calling. And that's what they emphasize. God has called you for this time in this place, and you are moving within what you're supposed to do. And I think if we just focus on what we're supposed to do, we're going to make impact doing whatever your gift is and just thriving in it. You're going to make the impact on other people who are watching you, and then you're going to actually accomplish the thing that you're trying to do.
Yeah, and finding out again, it goes back to actually finding out what that gift is, because then, just like the conversation prior of, you know, figuring out the reason you were saying figure out your why. That's the same thing. It's the same thing. Everything
Mhm.
seems to go back to let's go back to the beginning, back to the basics. And so with that, they need to figure out what their gift is, because some people don't even know what their gift is, and they haven't capitalized on their gift because they don't know what it is.
True.
Yeah. So here's something. Women are always trying to juggle everything. You're a wife, you're a mother of four. I just want to do obeisance to you because you got four kids. Oh my God. Um, what's your secret to maintaining balance, and how do you stay grounded with all responsibility? Because now I'm like, what in the world? Let me go back to the bio here. Okay, we got what is? Wait a minute now. What do we? She's already nurse practitioning, and then she's got the stuff at the VA, and then she's starting this foundation, and then I see wife and mother of four. What are we doing here?
I know. Yeah, a lot of people actually, yes, I get a lot of questions. And how are you doing this? And are you sure you're going to be able to? So I do prioritize my family first. I've always done that. Even when I was in nursing school, I actually already had two kids, and I just vowed I'm not going to miss a soccer game. I'm not going to miss a practice. Now, I would probably stay up all night. I'll probably miss some other things in my personal, enjoyment, but I always try to do my best at my role as a mother and a wife, because I feel like that's my first ministry anyway, as a mother and
Mm-hmm.
as a wife. So, and then I also draw from the strength of the Lord, because if God is calling me to do this, I just strongly believe, like, you leading me here, you gonna give me the strength to do it. And I learned that over time, because I am the type of person who likes to take on a lot of tasks anyway. I'm a high achiever anyway. That's a part of my nature, I think.
Mm-hmm.
But
Mm-hmm.
doing it in my own strength always led to burnout. Like, I would be like, done. I can't do this. I'll be complaining, whining. And not that I don't do that sometimes now. It's just when I recognize that I've operated outside of the zone, it's easy to draw myself back in. So spiritual strength is, I would be nowhere without the Lord. I really strongly, and I know this. And and then passion. Like, sometimes work is not work for me because it's fun. I actually enjoy it, sitting there working on projects and doing things. I truly want to see the change. So when I'm done, I don't feel burnt out. When my son is like, okay, you ready to go to the park? Yep, let's go. I'm not like, oh no, I've been working all day. I do feel that way about past jobs. Like, man, I remember I couldn't do anything, but doing this with community whole health is truly something that I feel this strength draws from the Lord, and from a place of, it's fueled by my dedication to it. And I just made a point to never take on a role that does not resonate with my core beliefs. I don't do that. And I've been offered jobs where I'm like, oh, that sounds good. It's a good thing, but is it a God thing? I have to review that. Like, no, I have to always weed out, what am I supposed to be doing? That sounds good. Oh, you want me to come to this luncheon? Oh, let me see what this is about. Oh, that would be nice. And you're going to pay. But I don't think that's a line, and I don't have time for that. And I think I'd rather be over here, going wherever with one of my children or my husband. And so I just had to put my foot down and learn boundaries.
So you're saying say no sometimes.
Yep.
Yeah, yeah. Say no. That's a powerful thing. No is a complete sentence.
Yep.
So, if you could go back to your younger self, what advice would you give yourself?
Hmm, I think I would tell my younger self not to be so impacted by the naysayers, and yes, setting the boundaries, because I became this way so strong in that because of the mistakes made in not setting those boundaries at first. So I think I would tell myself, if you believe it and you know the Lord told you to do it, just do it, because you're going to hear many opinions whenever you do anything anyway. I've realized that.
I mean, that is so true. And I'm glad you said that because I think that's a problem for a lot of people. You're going to have to believe in whatever it is that you're doing because you can't please everybody.
Yeah. And it's always going to you're going to draw attention, and people are going to give you their opinion whether you ask for it or not. So you
I
have to know,
know. What is
am
that
I,
about?
I
It's
don't
like, oh my
know.
God, and I don't want to be rude. I was, like you, I was raised a Christian or whatever. And so it's like, you're supposed to, be mindful and respectful. But it's like, and I'm thinking to myself, did I ask this person? Did I forget that I asked? you know, but they do that all the time.
Yeah. And I think, well, I don't want to assume for everyone because I'm not in their mind, but it seems to me that a certain people, especially when it's older people or older women at least, it's it's coming from a place of when they were your age, they may not have been doing that, this or that, and then when they see you doing this or that, it makes them like, are you sure of this? And it's not always coming from a place of I'm giving you wise counsel. It's coming from a place of, why are you doing this? It could be rooted unfortunately in jealousy. And I think we have to stop doing that.
We
Operate in
do.
what you're called to do.
We do have to do that. So speaking of that, I mean, like, what do you hope to see in the future of healthcare, especially since you work with veterans and you've got this community, your foundation work with underserved populations. What do you hope some changes for the future look like?
Well, I think in I hope that people, well, for the veterans at least, we learn to advocate better, meaning do your part in learning what you need to know, that foundational knowledge about caring for that population. And then also, people have to take accountability. I'm seeing a lot of that not happening. Even with the patients I've been serving for years, not just in veterans healthcare, outside of that, when I was in the private sector, I would ask a patient and get a health history, and I've been told so many times, oh, I don't know what medication I take, ask my doctor. I'm just thinking, is the doctor taking the medicine? I know they prescribed it, but you don't know what you're taking. People have to take accountability and care about what's going on with them. And I say to my patients all the time now, a lot of them are men. I'm like, don't you know you have some work to do left in this life? And don't you want to be in charge of that? That means being in charge in every aspect. Don't you want to be in charge of where you're going in your life and not have somebody else in the driver's seat? That means you start learning about this too. Know what the side effects are, know what it is and what it's doing to your body, at least. The very least, you should know that. So I think the future should be better advocacy from healthcare providers, but more accountability from providers and patients.
I agree. I mean, I'm glad that you brought all that up. Is there anything legacy wise that you would hope to leave behind by doing this? Having this nonprofit.
Yes, yes. I do. I just want to have a legacy that's not independent of my family, for one thing. But with the nonprofit, with Community Whole Health, I really want to be remembered to be dedicated to serving others and helping them to live stronger and longer, and people having the tools to do so. It is it is really just about that, just making sure that I actually did something to address health disparities, and I actually had a part in making sure that there was change for people to empower them and teach them tools that they need to live healthier lives.
Amen.
Yeah.
So, where can our listeners seek you out, find you on the internet, and that sort of thing? Where can they find you?
So they can connect. you can connect with us and learn more about what community whole health is doing on our website, really, at cwhclinic.org. We're also on Instagram and Facebook as Community Whole Health. So that's the best way to keep up what we're doing. Like I mentioned, we have a workshop coming up. It's called Prevent, Manage, Reverse, Take Charge of Your Diabetes Destiny. And it's really for anybody, whether you are trying to optimize your health, manage diabetes, or reverse it. We're going to have a registered dietitian and certified diabetes educator teach the workshop. So you can learn more about that either on social media or on our website.
And when is the event?
Oh, it's April 12th. It's going to be held at the Stonecrest Library in DeKalb County. So we'll have prizes, refreshments that are complimentary, and it's going to be a good time. But it's going to be a very good time to learn as well. It'll be fun, but we're going to be learning.
Will it also be virtual for people who don't live in the area?
No, not this one.
Okay. Okay.
Unfortunately, we're trying to encourage people to come back you know, in person and do things. I know for a while we've been used to the Zoom, and I do offer Zoom sometimes, but this particular one is gonna be in person, and really mainly because of the prizes and the way that we're gonna give them out.
Right, right. That's understandable. Well, Cashmere, thank you so much for coming in. This has been so enlightening. I even learned something about, my own situation with my family and my father's health and and everything. I mean, that's what I love doing these podcasts, Unseen to Unstoppable. I mean, there's so many things for us to discuss and talk about. And for you, you're working with these people who get overlooked. So I really appreciate you coming in here and sharing all that with us.
Yeah, no problem. Thank you so much for having me. I appreciate you and your dedication to highlighting women and what your story is as well.
I'd like to also thank everyone for listening and being here in this space with us. And to remember, you are never alone. Use your voice to uplift others. I'm Ilene Carol, and this is Unseen to Unstoppable.